Hello, this is Chris Group with EstheCeuticals and Aesthetic Advisor, and what we're going to be doing today is hair reduction on a gentleman's back, and we're going to do a really neat experiment. I'm super excited about it. We are going to be using our new hair reduction soothing serum, which is a sea kelp base. It's very anti-inflammatory. It does a great job of reducing the PFE, which is the perifollicular edema. That is one of the side effects of a hair reduction treatment. And we're also going to be using a section that we're going to put hydrocortisone on, 1% over the counter. You can get it at any pharmacy. And then we're going to be using an aloe gel on one section. So if you look at our client's back, it says SHA. SHA. So the S is going to be our soothing serum, the H is going to be the hydrocortisone, and the A is going to be the aloe. And when we get done with this treatment, we're also going to be doing some time-lapse photography to see how quickly the PFE comes down. And the results that I'm getting with my clients has been wonderful with our soothing serum. It's taken the PFE down, it's taken the erythema, which is the redness, down really, really quickly. And it also gives me something to sell to my clients because they can take it home with them, of course after you sell it to them, and it allows them to continue treating their skin and reducing the inflammation. And it's also great to use after shaving. So the treatments in between our hair reduction treatments is always shaving. You can't do anything else, which means it gives them something to help treat their skin after they've been with you. So I'm going to put my goggles on and we are going to start. I already have his test spots done. So I've got my handpiece ready to go. You can hear my machine ramp up. And as I'm doing the treatment, we're going to talk a little bit about why we have decided to do a soothing serum. The biggest thing is when we do hair reduction treatments, there's really not anything to use post-treatment except for aloe or hydrocortisone. A lot of people don't like hydrocortisone on their bodies. They think it raises their cortisol levels. I am not necessarily of that belief, but I believe in what they want to believe in. If they don't want me to put it on their skin, I'm obviously not going to. The other option that you would have is aloe gel. Now, aloe gel, quite frankly, really isn't going to do anything in the skin. It may feel a little bit nice going on, but it's not going to do anything to actually reduce the perifollicular edema or the erythema. So, even though it may feel nice going down, how are you doing? Doing okay?
I'm all right.
Okay. Make sure you check in with your client once in a while. So the aloe is really not going to do anything anyways. Okay, so those have always been our two options in doing hair reduction. At EstheCeuticals, with all of our background in using these machines, I've got over 10 years. I have probably about 40,000 hours clocked with these machines. I wanted to take care of my client's skin after the treatment, but there wasn't any options out there. So we looked at developing a product that would help with the perifollicular edema and the irritation of the skin. You can start seeing his skin is getting some erythema right now. But we wanted to be able to use something that, one, actually worked, two, wasn't horribly expensive for our clients to use, but again, allowed us to retail a product to our clients. So when we started using our EstheCeuticals hair reduction soothing serum, which is right here, our clients started talking about the difference that their skin felt right after the treatment. That I actually had one client who said that her skin normally after a hair reduction with IPL or a laser kind of felt like shingles on a roof but going the opposite way, so it kind of felt very irritated. when I put the soothing serum down on her, she didn't have any of that irritation. Her skin felt very hydrated, and it felt really, really good after the treatment. When I started looking at the PFE, the perifollicular edema, which is really hard to say 5 times fast, by the way, I noticed that usually within 15-20 minutes, the PFE, by using the soothing serum, was really, really reduced. I wasn't having to use as much ice to reduce the PFE, which is another option for you. But it just gave my clients a great result. Much happier. As a matter of fact, before I had it all in these bottles and ready to go, one of my clients was like, okay, so where can I buy this? Which the answer was, well, you can buy it here as soon as it's in a bottle. Now it's in a bottle, by the way. So when we look at all of the different laser treatments that we can do, and all the non-invasive treatments that you can do, hair reduction is number 1 with a laser. Okay, Botox is the number 1 non-invasive, non-surgical treatment. Hair reduction is number 2. Lots and lots of people are having these treatments done, but until EstheCeuticals skin soothing treatment or skin soothing serum, there wasn't any options for you besides, again, hydrocortisone, which they're going to get at their local pharmacy, or aloe, which you're going to get at your local pharmacy or grocery store. So it gives your practice a great option in retailing a product that really does work well and helps give them a better outcome. Everything that we do with our EstheCeuticals products is pretty much about how to mitigate some of the damage or collateral damage that may be from the actual treatment, and to provide a better treatment and a better experience for our client. Now, I am almost getting done with this, and when I do, I'm going to take the gel off, and you're going to notice some of the PFE bumps. It's got some erythema. You can see it's a little bit blotchy right now, which is totally normal. If you were in the room with us, you could smell what I call success, which is the hair follicles burning. It's not a skin burning. And so he's going to get a great treatment out of this, and then we're going to do our little experiment, which is going to be really fun. Almost done. A couple more rows. By the way, when you're doing hair reduction, you want to make sure that you continually wipe your hand piece off, especially in areas where you might get a little bit more of that smell of success or hairs popping out. You don't want any carbonized hair on the lens that you're shooting through. So try about 3 more rows, and then we're going to remove the gel and put down our different products. I was talking to somebody on the phone last night who's been an esthetician and a laser tech for quite a few years. And I was telling her about the product line, and she was like, you know, I never thought about retailing a product after a laser treatment. I said, well, because there really hasn't been any product to retail. I mean, you do a facial on somebody, you're always trying to retail, you know, a face cream or a cleanser or things like that. Well, the machines that we use, the lasers and the IPLs, are huge, huge treatment-based modalities, but there hasn't been anything. So with EstheCeuticals, we created products for hair reduction, for photofacial, and for fractional treatments. So it doesn't matter what machine you're using. I could be using a different machine for hair reduction on my client. I'm still going to use the same product, which is our hair reduction soothing serum. So I'm going to shut this machine off. You're going to be able to hear me a little bit better. I'm going to get my super sexy goggles off. And what I'm going to quickly do is remove the gel. And you can already see the PFE bumps. How are you doing?
I'm doing great.
So we can see the PFE bumps. I'm going to try to keep my little racing stripes here. That's in my age. I'm trying not to remove that too much. So then we can get the products down. And then we're going to also ask our client what he thinks. with the feeling of the 3 different products. Now, this is a great treatment on him. You can see the erythema. You can see the PFE. You can especially see it right through here. This is where on the sides you might have felt a little bit more pain. This is where the heavier concentration of hair would be. And up through the back, you see it's pretty much the same all the way across. Okay, so this is where the fun part starts. You're going, okay, Chris, that was super fun. Yeah, I just dumped all of my products over. But I'm going to find which one is, oh, for gosh sakes, are you kidding me? Where's my product? Here we go. Hair Reduction Soothing Serum. Okay, you can tell that this is real life because I just dumped all my products. So I'm gonna put these products on and we're gonna come right back. Okay, we're back, and yes, my products are still dumped over behind me. This is the soothing serum we're going to put on this area. It's right here. That's EstheCeuticals Laser Ease Hair Reduction Skin Soothing Serum. This section right through here is going to be hydrocortisone. By the way, before you put this on anybody, always make sure that they are okay with hydrocortisone. A lot of people aren't, again, but it's basically all that we've had for the last 10-12 years of hair reduction has been this. Okay, and then I'm going to put the aloe gel on this side. Okay, so now we've got everything down, and I'm going to lift this up so you can breathe, okay? And Jonathan, can you tell me a little bit about what you're feeling with the 3 different products? Do you feel any difference or any of it going down? Did anything feel different?
Let's see. I don't feel too much pain on any of them. The serum on the left is a little bit more moisturizing than the cream in the middle. The aloe was a little bit stickier, so that wasn't as great. In terms of pain, I don't feel too much, so it's very hard to compare them. Okay.
Well, what we're looking at right now is just to see how quickly the erythema comes down and how quickly the PFE comes down. So again, you can kind of see through here. We still have some erythema on this side. We still have it on the opposite side. The 2 sides are going to have a little bit more erythema and PFE just because the coarseness of the hair and the density of the hair. The areas that have more hair or more dense hair, more coarse hairs are going to have more PFE bumps. So if we look through the center of his back, he didn't have a lot of hair in that area. I always go over the entire area though because I might pick up a few hairs here and there, and that's what he came in for. So we're just going to let him sit for a couple of minutes and then we will come back and take a look. Okay, so we're about 20 minutes post into the treatment, and what I wanted to show you was the difference between the 3 sections. So over here we had our EstheCeuticals Hair Reduction Soothing Serum. In the center we had our hydrocortisone, 1% over the counter, and then on this side we had our just regular aloe gel. And if you can look at it now, the hydrocortisone area doesn't have as much erythema. Part of that is because there wasn't as much hair in this area, but hydrocortisone actually does take down perifollicular edema. The problem with it is a lot of people don't like it, and you also can't retail it because it's $1.79 at the store. The skin soothing serum, you still have some perifollicular edema, the PFE. You still have some of the irritation, the redness. But when you look at the side with the aloe, and this is why I say that aloe really doesn't do a lot, you can actually see the bar marks from my machine. So when you look here, you see like one here, one here, one here, one here. You can see up here and here. Over in this area, it's pretty diffuse. What that means is it's kind of spread
and kind of gone away. You can't see the actual marks of my machine, which means the skin is starting to release that heat. The erythema is starting to go down. Whenever you see the bar marks on the skin, there's still quite a bit of heat in that tissue. So what this is showing is hydrocortisone. Like I said, it does take down PFE, but a lot of people don't like to use it. The aloe, I don't really think does too much of anything. The skin soothing serum is taking down the PFE and the erythema. It's starting to diffuse it. And I'm gonna ask our client one more time, since he's been sitting here with us on him, and he's about, I said, probably about 23 minutes now post. What did you think, or what do you feel now with anything, if there's any difference?
Well, I do feel a little bit of irritation on the right-hand side, which I think is the aloe side.
Okay.
The left-hand side, which is the serum, I don't feel very much at all, which is a good thing. So in general, it feels great.
Okay, so what he's saying is he feels less irritation on this side than this side, which if you look at the skin, the differences between the two, that totally makes sense. So now what I'm going to do is I'm going to get his little SHA off of his back, so he doesn't have that, not like you would see it with his shirt on, and get him ready to go with some post-care. And so again, this is Kristen Group. I am with EstheCeuticals, and this was a demonstration of our EstheCeutical Laser Ease Hair Reduction Soothing Serum. Great product to use post hair reduction with either lasers or IPL devices. Also a great product to retail to your clients so they can take it home, continue losing some of the irritation, also to use after shaving. And actually, my daughter got a really bad sunburn this weekend. She forgot to put sunblock on one section of her back, and we used the soothing serum on that, and it did a brilliant job of reducing the pain in the erythema from her sunburn. So again, Kristen Group with EstheCeuticals, thank you so much for watching.